And federal funds for one global health challenge will be shifted to fighting a newer global health emergency. The White House says nearly $600 million earmarked for the Ebola outbreak will now be used to fight Zika. According to the CDC, there are at least 346 Zika cases reported here in the United States, with Florida leading the nation. Let's go now to RT's Marina Portnaya in Miami for more details. Hi there, Marina. So for months, we've heard health officials insist that the $589 million of federal funds left over from combating Ebola should not be reallocated. Why all of a sudden the pivot by the Obama administration?
Well, because, Manila, time is of the essence, and Congress still hasn't approved the $1.9 billion emergency funding for Zika that President Obama requested 2 months ago. With warm and humid weather just around the corner, mosquito season will be in full swing, and federal health officials say they can't wait any longer to prepare for a potential outbreak. Now, most of the $589 million of Ebola funding, officials say, will now be devoted to vaccine research and mosquito control for Zika. But this funding, honestly, is just a Band-Aid. Officials from the CDC and the National Institute of Health say that if Congress does not approve the $1.9 billion emergency supplemental funding for Zika, they will not be able to manufacture vaccines, purchase diagnostic tests, and increase mosquito surveillance control. Now, Zika is causing widespread alarm because of its link to microcephaly, a birth defect which causes infants to be born with neurological disorders and underdeveloped heads. Zika can be transmitted through the bite of an Aedes aegypti mosquito and also through sexual contact. Federal officials estimate that 40 million people will travel between the U.S. and countries with Zika outbreaks in the coming months.
Now, the officials do say that the Aedes aegypti mosquito is the primary vector carrying Zika. It's clearly most commonly found, obviously, in the South, right? So does that mean states like Florida are going to be the most at risk?
Well, Aedes aegypti is the primary mosquito here in Florida, and there is a higher chance of an outbreak in the state, no doubt about it. Florida's Governor Rick Scott declared a public health emergency for Zika 2 months ago, and yesterday 2 new cases were confirmed in Florida, bringing the number up to 82 cases of Zika in the state reported since February. But it would be irresponsible to assume that this is a public threat that can be concentrated or contained to certain areas of the country. In the U.S., 346 travel-associated cases of Zika have been reported across 41 states. Now, 32 of the infections involve pregnant women. 7 Zika cases, according to the CDC, were sexually transmitted. And in U.S. territories like Puerto Rico, an additional 354 cases of Zika have been reported, including 37 pregnant women. So this virus is something that can go beyond one border or 2 borders. And the most important thing right now is public awareness and prevention. In order to prevent an outbreak or be prepared for one, federal health officials say they need the proper funding.
Exactly. Thank you so much for highlighting that. It's certainly a borderless disease. Thank you so much. That was RT correspondent Marina Portnaya reporting from our Miami studio.